Hello guys, welcome back to my channel. I'm Renee Michelle. Don't forget to hit the like button, subscribe button, and that share button. Also drop some thoughts in the comment box and let me know what you think about this content here. Wow, y'all better be careful out there in Massachusetts because it's a cluster of hepatitis A outbreak that was reported in the state. Massachusetts health officials are warning that the hepatitis A outbreak has hit the state. It is similar to an outbreak that occurred several years ago. 10 cases have been confirmed since September the 1st of this year, which with more than half occurring since November the 1st. That's what the Massachusetts Department of Public Health told ABC News on Tuesday. Some of the cases have been severe, with 7 requiring hospitalization. However, no deaths have been reported. The patients are between 35 and 60, with the oldest being 46 years old. 7 of the patients are men and 3 are women. 8 patients are white and 2 Hispanic patients. Several of the patients reported being recently homeless or have unstable housing, as well as a history of injecting other drugs, according to the alert issued Monday by the health department. The department also said that many of these patients have sought services at Boston area clinics, shelter, and substance use treatment facilities. The patients do not have a history of traveling outside of Massachusetts and do not share any common sources of food and drink and drugs. This says the cluster of the cases is similar to an hepatitis outbreak that began in March in Massachusetts in April of 2018 and ended in May of 2020, which resulted in 563 cases and 9 deaths. The outbreak mostly affected people experiencing homelessness or unstable housing or substance use disorder. There were similarities in the risk factors between the cases between here and those reported during the 2018 and 2020 outbreak of hepatitis A in Massachusetts. Cases here are reported recent homelessness or drug use, including injection drug use. People who have unstable housing or experiencing homelessness are at increased risk of hepatitis A infection. During that period, there were large clusters of hepatitis A in California, Indiana, Kentucky, Michigan, Tennessee, Utah, and West Virginia. Hepatitis A is a very contagious liver infection caused by hepatitis A virus. The virus is found in stool and blood of an infected person, and is spread through close person contact with an infected person, or by eating contaminated food and drinking behind somebody. Even if you talking and you spit, you could possibly get hepatitis A from a person. Wow. This is one that, unlike the other hepatitis virus that we are familiar with, this is one that is transmitted through the fecal oral route. Due to ill. So it's not transmitted through blood or other bodily fluids like hepatitis C, for example. So what do you mean by fecal then? It is often a result of situation where they may be poor sanitation, overcrowding, poor bathroom facilities, things like that. It is not entirely surprising that we're seeing another outbreak in a similar way to the last time we had this in Massachusetts. That's a shame. Massachusetts just must not be clean. Nastiness over there. Because y'all just had one in 2018. It's 2023. The one in 2018 went all the way to 2020. What's going on? That is crazy. Let's see. So it's not transmitted through blood or other bodily fluids like hepatitis C. I read that. It affects people who are homeless or having unstable housing because they experience risk factors of the virus. Not all hepatitis A patients experience symptoms, but when they do, it usually occur between 2 and 7 weeks after infection. Symptoms can include loss of appetite, fever, diarrhea, fatigue, stomach pain, nausea, and vomiting. You can also have a change in color of your stool where it becomes gray or losing color. Oh, I guess that's what you mean by the fecal oral route. Okay. That's pretty distinct sign that should send you right to the doctor. That's correct. The CDC says the person can transmit hepatitis A without showing symptoms and can do so up to 2 weeks before the symptoms appear. I wouldn't be messing around with nobody out there. Y'all better be careful. There are no specific treatments. What for hepatitis A? Well, doctors typically recommending rest, adequate nutrition, and fluids. In a rare case, hepatitis A can lead to liver failure. Rare, they say it don't. Okay, so it's unlikely. Can lead to liver failure, death, but this is more common in those who have underlying conditions such as chronic liver disease. It says if a person has been exposed, there's a hepatitis A vaccine that can help prevent the virus from taking hold with a single shot given within the 2 weeks of exposure. There are also two types of hepatitis A vaccine that can be given to prevent preventative measures. One given as 2 shots 6 months apart, and the other beginning to combination of vaccine that protects against hepatitis A and B is given as 3 shots over 6 months. Recommends children receive the vaccine at 1 year old and through the ages of 18 if they're not previously vaccinated. Additionally, the CDC recommends that the high risk adult groups, including international travelers, men who have sexual contact with other men, people who use injection or non-injection drugs, people experiencing homelessness, people with chronic liver disease, people with HIV, people occupational risk, and people with close contact with people with international adoptees get vaccinated. Adults without risk factors who want to avoid hepatitis A can also be vaccinated. This is important because we don't want this outbreak to grow to the size of the last one, which the last one shouldn't have got that far. What y'all got going on down there? That don't make sense. Anyone in these categories should be getting vaccinated now, and we should be doing all we can do to identify people anywhere we can, anywhere we see them. The health department said it is working with local health officials to relevant stockholders to promote and to make vaccination available at the risk population, including those experiencing homelessness. The chief head doctor said that the CDC says another important prevention measure is making sure hygiene and sanitation standards are up to par, including encouraging hand hygiene at facilities that severe high-risk population and regular disinfection of high-touch surfaces, bathroom facilities. Experts also recommend educating high-risk populations and agencies that serve them on the signs and symptoms of hepatitis A. The need of vaccination and hygiene measures to the limit of the spread. So, in message, y'all better get it together out there because y'all got an outbreak of cluster of hepatitis A, and it's highly contagious. I just wanted to bring this story to you guys because I think it's important. You know, they didn't had this one time, they had this twice. You know, and just the reminder of how many people, it was 500 and let me see what it said, 560 something people that had it in 2018. It wasn't the specific type of hepatitis A, but it was a hepatitis outbreak at that time. So y'all better keep it clean. Now I gotta go. Talk to you later. Bye.